All right, welcome everyone. Thursday morning. Thanks for being here. Really appreciate it. Today, well, my name's Jen Hansen, as many of you already know, and I'm joined by Neil Pearson today for another session of Gentle Movement at Home. Just a little note about the purposes of these sessions. So we're not able to give individualized medical advice. If you do have questions at the end that are about specific injuries, our advice is to speak with your healthcare provider. Neil will do his best, but it really requires individual consultation. Sorry. You can view this session after today's session we're recording, and it will be available through our Facebook videos and also on our YouTube channel. Just a reminder that we have the feedback poll at the end. If you could just stay and fill that out and let us know what you thought of today's session. And of course, email us or put your questions in the chat. If you do have questions for Neil, we'll take some time at the end. If you put them in the Q&A, that would be great. And we'll just take a bit of time at the end and have a chat if people would like to know more or have questions about the movements that you try during this session. Mm-hmm. Just a reminder, we've got another session tomorrow at noon with Carrie Jacobson, a physiotherapist. Neil is back next week. And then on Wednesday, we have a new instructor, Colleen Jorgensen. That should be great. Looking forward to Colleen's session. Okay, Neil, I'm going to stop my spiel and over to you.
Great, thanks, Jen, and welcome everyone. So as Jen mentioned, with all these sessions, you have to start with what feels right for you. So today what we're going to do is start laying down. If laying down isn't something you can do today, you can come from a chair. There will be a number of things that are really hard to modify from a chair position. So in that case, what you can do is to imagine yourself doing that movement with ease or more ease, or create a sensation in your body that you're doing that. But we'll just carry on with the instruction today. Let's going through different positions. We'll start laying down. I'm going to start sitting up just for the beginning because it's easier to interact with the camera and you this way. But then I'll come down as we start to do the movement, and we'll be on our back. So if you want to start laying down on a yoga mat or on the floor or on a carpet, maybe have something underneath your head, either have your knees bent or something behind your knees, or you can start in that seated position if that feels best. And as we go along, we'll be talking about, if you need to pause or change what you're doing, do that. Even right now, go ahead and do that if you want to. So we will move from laying down and we'll come on up actually onto our hands and knees at one point, and then we'll come up to a standing position and then back down into a seated position. So we're going to change position a few different ways, a few different times today. So as you go along, just keep on checking in to make sure that this is the right thing for you to do. All right, so hopefully now you're in that place of comfort. Either you're laying down on your back or you're sitting in a chair. If you're laying down, just position your arms where they'd feel most comfortable. If you're seated in a chair, let your hands rest where they'd be most comfortable. You can have palms down, side, up, whatever you'd prefer. If you are sitting, just find a little bit of length in your spine. Let your shoulders relax a little bit, and let the muscles around your neck and your jaw and your face and your ears and eyes all relax just a little bit. If you're laying down, of course, set that intention to stay awake, stay aware. This isn't about time to actually, it's a time to rest your body, but a time to keep your mind focused a little at the beginning. So we tried this breathing technique once before. We'll give it a shot again. So what I'd like you to do is start with taking your awareness to the sensations of the air as you breathe in and the sensations of the air as you breathe out. So feel the air as it comes in and feel the air as it goes out. You don't need to change anything just right now. Just feel the sensation of the air as it comes in your nose or your mouth as you breathe in, and the sensations of the air through your nose or mouth as you breathe out. And as you're doing this, create a sensation as if your eardrums are sinking in towards each other, towards the middle of your head, or even back towards the back of your throat where you feel your breath moving. And create the sensation that your soft palate is gently raising up towards your forehead or the crown of your head. And feel the back part of your tongue sinking down towards your heart. So you may feel that there's more space at the back of your throat at this point. Soft palate releasing up, tongue releasing down, eardrums sinking in towards the center. And maybe now you can feel the air swirling a little bit at that back of your throat as you breathe in, and the air swirling a little bit at the back of your throat as you breathe out. You might even be able to hear your breath just a little bit as you breathe in and as you breathe out. So for now, don't try to make sound. So if you can hear it, great. If you can't, that's all right. Stick with the feeling of it. Remember, if you need to catch your breath, just pause, catch your breath, come on back when you feel ready. If you need to shift around, go ahead and do that. So whether you're laying down right now or seated, your mind is focused, your attention is focused on the sensation of the air as it comes in, and the sensation of the air as it goes out. You're feeling your soft palate releasing up, back of your tongue releasing down, eardrums releasing in. Feeling that air swirling at the back of your throat all the way through your inhale and all the way through the exhale. As you continue to breathe that way, create a sensation of increasing warmth as you breathe in. As if you're breathing in, you're feeling that sensation of the air swirling, but you're breathing in warmth into your body. The breathing out is just a release, and the breathing in is creating that sense of warmth in your body. Now, there is the possibility that as you're sitting there doing this or laying there doing this, you're feeling like, I actually would rather have coolness in my body. So feel free to do that. If your body already feels like it's got too much heat in it or too much warmth in it, absolutely fine to create a sensation of coolness as you breathe in. So you get to decide warmth or coolness. And sometimes as people do this, it helps to add other things in. So it might help to add in to that sense of warmth or coolness. You could add in a sensation like a color is being breathed in. So maybe you feel like there's a color of yellow or maybe orange or blue, along with that sensation of warmth or coolness. So you still feel that sensation of the air swirling at the back of your throat as you breathe in, as you breathe out. As you breathe in, you create that sense or feel the sensation of a change in temperature, and maybe you've added in that color. Now see if you can extend that out to more of your body. So feel that sensation of change in temperature as you breathe in, as if it's going into your legs. Maybe a few breaths into the top of your legs, your hips, and your thighs, and your knees. And as you continue, you might be able to feel that moving further down into your legs, down into your feet. So maybe it's a sensation of gentle warmth and the color yellow spreading into your legs a little bit more with each breath in. Remember, even with this, you can pause anytime you want, release what you're doing, catch your breath, move around, whatever you'd like to do. If your mind starts to drift away, come on back to what we're doing. And then see if you can take that same sensation out into your shoulders and your arms, or those sensations into your shoulders and arms, while you're still feeling the soft palate releasing up, the base of your tongue releasing down, your drums sinking in towards each other. So now you may be feeling, as you breathe in, that sensation of warmth or coolness going all the way through your body. You may be feeling a color or envisioning a color spreading through your body. And just for a few breaths, feel it. Feel those things spreading into every part of your body, even those parts of your body where you may have tension or discomfort or pain. At any point during this practice today, if you feel like it's time to stop moving, if you can, come back to this. Come back to your breath. Once you feel that breath again, then come back to creating the sensation of warmth or coolness, whatever you feel like would benefit you best, and see if you can bring in a color, if it would help to have a color. And of course, as you've been doing this and it was just confusing to add in a color, then you can let that go. Or maybe the color worked and the temperature didn't. So choose whichever felt like it was the easiest to do. Try to create those sensations spreading through your body with your breath. If you are in a seated position, you can come down onto the floor. Come on down on the floor now. And we're going to focus a lot on using our legs today. So I'm just going to come down on my back. So from the back position, I'm going to have my arms just resting here. First thing I'm going to do is just bring my knee up to my chest. So you give this a try, just pull it into that just right spot, and then let your leg come on back down again. We're going to focus a lot on movements around the hips and the legs today. So remember, it's perfectly fine to pause anytime you want. It's perfectly fine to challenge yourself a little bit more. And we'll be reminding you of the idea of go to the edge where you feel like that's far enough. Go to the place where you feel like it's safe for your body. That place where you feel like you're not going to regret it later if you do it like this. And then while you're doing that, keep your breath flowing. So maybe right now it would be best to feel your breath like we did at the beginning. Maybe it'd be best to let your arms and legs relax already at this point. If you can, have your knees bent now. Your feet are flat on the floor. If there's something underneath your knees, you can move it out. But right now I've got space for that. What I'm going to ask you to do at this point is just keep your right leg straight, or right leg bent. Take your left leg down in front of you. Smooth out your breath again. Release tension in your body. You can have your head straight looking up. And then as you breathe in, just gently lift that heel up and then bring your leg back down again. Or the other option you would have is to hold onto the back of your thigh and lift your leg this way and let it down. Just do that a few times, either this way or with your leg down the floor and then just lifting your leg up off the floor and bringing it back down. Keep your breath flowing as you're doing this. Do your best not to let your body get too tight. And when it's time to relax, just release, let your body release back down again. You can keep on going if you want to, if you're just feeling okay, but I'm just showing you it's fine to actually take a moment and pause. Sort of come back to where it would feel best. As you lift up your leg, ask yourself those questions. Can I keep my breath flowing? Can I keep my body tension low? If there's pain, can I go just to the edge where the pain gets a little bit more? And when I pause, does the pain come back down again? So if you are still moving, let that leg relax. Switch around with your legs. Let your left knee bend. Take your right leg down on the floor. Come back to your breath again. Release the body tension you don't need. And maybe think while you're doing this, I'm going to be using my leg, but can I keep the muscles around my chest and my shoulders and my neck and my face in that softer, calmer place? Can I try to move my legs without getting too tense in the other parts of my body? So you're resting here, you've got your breath going, and then you just lift this leg up this way and back down. When you come down, let it release before you do it again. Or if you'd like to, do it with holding onto the back of your leg. So I've relaxed my leg now and I'm straightening my leg up this way and coming down. Whichever one of these movements feels best for you today, you get to decide on the challenge. Maybe today is the day to do the easier way, or maybe today's the day to take a little bit more challenge and you can go this direction. Now, if you're feeling like you really want some challenge while you're doing this, to see if you can really keep everything calm while you're lifting that leg up and putting it back down again, if you know your body's fine with it, you can take both your legs out and you can work on trying to lift both your legs up a bit and bring them back down again. Right? So you need to take care. There's a lot of effort to do it, but some of you may say that this feels okay. I can still keep my breath flowing. I'm not gripping too much. I'm not getting too tense around my neck and head and face. But if you try it and you feel like it's too much up here, you don't feel like you can keep things calm, then come back to one leg at a time. And you could, if you wanted more challenge from here, is to take your leg up and take it into circle this way. Stay, keep your breath calm, keep your body calm. And if you've tried this with one leg, then let's give it a try with the other. Let that leg come on back down, bend the right knee up, put that foot on the floor, soften the muscles that you don't need, keep the muscles soft, keep your body tension low and your breath flowing, take the leg up and then take it into some gentle circles, whichever direction would feel better for you. Make sure that you continue to pay attention. Am I safe? Do I feel like I'll be okay later? Can I keep my breath calm? Can I keep my body calm? And let your leg come on back down again. So next thing I'm going to ask you to do is to come onto your side. So if there's a blanket there, you'll probably need to move it out of the way. So whichever side you want, I'm just going to roll so I can face you. So whichever side you're on, find a place where your hips are a little bit bent, top leg is straight. Come back to that breath again. Notice the tension here. And so from here, you're going to lift your leg up to the side. While you do it, try to keep soft as you can around your neck and your face and your jaw. Keep your breath flowing in and out as you lift your leg up. If you want to lift it up higher, go up higher. If it's best to just lift it up a little bit, do that. So notice as you do this, is your breath still staying in that calmer pattern? Is your body tension getting too high? If there's pain around your hip or your pelvis or your back, can you go to that spot where there's just a little bit more and then let your leg down and pause and feel it calm back down again? Can you do it to the spot where you feel like that's a good challenge and I know I'm going to be okay later, or I believe I'm going to be okay later? I see it that way because sometimes you're not quite certain. So if you've still been moving your legs, let your leg come on back down again. Now we're going to get you to roll over onto your belly. So you probably need to move the pillow from here if it's in front of you. So from this position, you can be up on your elbows like this, or you can lay down with your head down. I'll just stay up because it's easier to look towards the camera as I'm doing this. So bring your shoulders down a little bit, find the right place for your head and neck to let some release happen. If it would feel good to shift your hips around a little bit, do that. And then from here, you have choices again. You can lift up by lifting up, bending the knee, coming up and back down again. Just bend the knee up, back down again. If you'd like more challenge today, the idea is lift your leg up and bring it back down. It's okay if your pelvis rolls a little bit, like you're probably seeing mine do that, but try not to really roll around. Just work on seeing if you can move more towards the hip. And while you do that, you're keeping your breath flowing. You're not feeling yourself getting too tense around the face or the jaw or the neck or the shoulders. And when you're ready, give it a pause and just shift around again. And please remember that you don't have to wait for me to stop. If you feel like it's time to stop, go ahead and do that. And then try the other leg. Bend the knee up, back down again, or lift the leg up and bring it back down again. As best as you can, keep your breath flowing. Try not to hold your breath while you do this. If you feel your body getting tense, do your best not to let that tension build up. Sometimes it's best to pause and just release and lay down and let go. And maybe when you get here, you feel like, I'm going to need a little bit of time to let go. Or maybe from this position, you feel like as soon as I come down, I relax and the tension goes away and it's okay to start back up again. Now, if you are still moving, you can keep on going, or one of the things you could do here is to bend or lift both legs. So if you're laying down and you want a little bit more challenge, you could bend both knees up at the same time. Or if you're laying down like this and you want a bit more challenge, you can rest and lift both legs up and bring them back down. Lift both legs up and bring them back down. Just keep on going through those questions. Is my breath calm? Is my body calm? Do I feel like I'm going to be okay if I continue doing this? And anytime you start to think that's enough, pause, relax. If you need to come back and change your position in any way you want to, that's perfectly fine. So if you are still moving, let your legs relax. The next thing to do would be to go over on your other side, but I'm not going to roll away from the camera. I'll just go on this side again. So if you can, roll over onto your other side. Find the right position for your arms. So maybe your head's down, or maybe you're up on your arms like this, or even up here if that would feel better. And from whatever position you choose, you'll lift the other leg up. So the idea is just lift it up wherever feels good and then come on back down again. If there's any pain, you're just nudging into the edge of it. You're not trying to force yourself through it. If the pain is building, you might say, well, maybe I shouldn't lift my leg up so high, or maybe that's enough for right now. Or sometimes we find that if the pain's building and we can keep our breath calmer, if we can decrease the tension in our body or smooth out our breath, sometimes that will allow us to continue without provoking the pain more. If you need to pause, let your leg relax. Come on all the way back down if you really need to let go of the tension, or you can carry on. So if you're still doing that movement, let's pause there. From this position, go back onto your belly again and come on up onto your hands and knees. So you may find once you're on your hands and knees that you want to have a blanket underneath your knees. Just kneel on something, or maybe you want to have it underneath your hands as well. So the idea is to sort of find the right spot here where you feel that you're not rounded up like this or in a big back bend. You're sort of in a neutral spot with your spine. And you can, if your wrists aren't liking a lot of force on them, just bring your knees back a little bit. If you like having more pressure on your wrists and less on your knees, then bring your weight a little bit forward again. So we're working on our legs today. Oh, and by the way, if you want to take your hands out in front of your shoulders, that's fine too. They don't need to be right underneath your shoulders. Sometimes that can change everything around your wrists and your neck. But find the right spot. Come back to smoothing out your breath again. Noticing that tension around your face and your shoulders. So you want to do your best to do this without too much increased tension. And from here, you're going to lift your leg. So you lift your leg straight back and put it back down. And we'll go back and forth with your legs this way if you can. So try one leg, lift it up. Maybe the leg just comes up and the toes are still on the ground as you put your leg back. That's perfectly fine to do that. Or maybe you like a big challenge today and you can lift your leg up higher. While you're doing it, keep checking in. Does this feel safe for my body? Do I think I'll be okay if I continue with this? What's happening with my breath? Remember, you can pause anytime you want to. You don't have to continue just because I'm continuing. What's happening with my body tension? If it's building up, see if I can calm it down. Maybe I'm getting tense around my back or my hips or my arms or my neck. Now, unlike the other ones, this is not a movement you can do with both legs at the same time. But if you want to add more challenge to this, or maybe I should say this, if you want to pause, if it's time to pause, pause, and you can come down and just come down onto your heels, or sometimes people like to rest down like this, or right down in your belly. If you want to continue on with this to make it more challenging for today, as you lift your leg up, you can lift your opposite hand. So if you try this and it feels like that's too much, either pause and stop, or come back to lifting your leg by itself. And you do have the option of lifting your arm by itself if you'd like to. Today we're trying to focus on legs, hips. So if you can, keep your legs going. If you've had enough, for any reason you want to or need to stop, go ahead and do that. And then when that next hand comes down, just pause for a moment. If you can, come into a kneeling position. If this does not feel okay right now, then come back down to laying down on your back or your side or your belly, whichever would feel okay. And then just twirl your wrists around a little bit or move them back and forth. Just take some of the pressure off your wrists. My knees don't mind this position, so I'm okay here, but if this is not good for you, then come back to a seated or laying down position and just give your wrists a little bit of a shift around. Give your shoulders a little bit of a shift around. Remember, we're trying to keep things in the upper body from getting too tense today. And now we're going to come back onto your hands and knees again. So once again, find that right amount of force through your wrists. So maybe you put your hands out further, or maybe you put them more underneath your shoulders. Maybe you bring your hips back over your knees a little bit more so there's less weight on your shoulders and wrists. You have to try that out for yourself to find that right spot. From here, this time, round your spine. Bring your chin towards your chest, round your spine up towards the sky, and go the other way. We're going to give your legs just a little bit of a break. So just move your spine into whatever rounding and gentle arching feels good. Keep your breath flowing as you do this. If you notice your body tension building up, then you can pause. Great. And either lay back down again now or come back to a kneeling position and just give your wrists a bit of a movement around again. Just let the blood flow start going, stretch out anything that has a little tension building up there. And from here, we're going to come on up to a standing position. So take your time. So when you're ready, come on up to a standing position. Feel your feet on the floor. Shift your hips around just a little bit. Let some of that tension go. Give your shoulders a little bit of movement around. Come back to that breathing practice that we did at the beginning. I should mention, if you feel best with having a chair beside you, so you have your hand on the chair or your hand on a wall or something, just to feel a little more stable with standing, go ahead and do that. If you feel like standing, you need a bit of a break from standing, go ahead and sit down. Feel your feet on the floor. Feel a gentle sense of length of your legs, length of your spine. Let your shoulders relax. Come back to that breath that we did at the beginning. Create that sensation that your eardrums are sinking in towards each other, that your soft palate is releasing up towards the top of your head or your forehead, that the base of your tongue is sinking down towards your heart, so there's more space back there. As you breathe in, you can feel the sensation of the air swirling through that spot. As you breathe out, you can feel the air as it swirls through that spot on the way back out. So your focus is there. And as you focus on that spot and that sensation, release tension you might have around your neck or your shoulders, tension you might have around your ears or your eyes or your jaw. Divide your attention between that breath and the sensation of releasing tension around your shoulders and neck and jaw and face. And then as you continue with that breath, shift your attention down to your pelvis and your lower back and to your hips, those muscles you've been working a little bit today. See if you can release tension in this area that you don't need. You're standing, so you need some of the effort in those muscles, but see if you can let extra effort go. And one of the ways you can check in with this as well is to create more tension in those muscles. So tense up the muscles around your hips and your pelvis and back just a bit, and then release it. Release it so you feel like the effort is decreasing, but you're still going to stand up. You're not going to crumple down at all. So you've got your attention on that sensation of the air swirling through your throat on the way in and swirling through your throat on the way out. And you're releasing tension in your body you don't need. So from this position, either with your hand on a chair or standing still, let your knees bend. and then come on back up. Just do a few little knee bends, like you're coming towards a squat, but you're not going very far down. So I'm only going down this far, then coming back up. So I'm trying to keep my spine up pretty tall. I'm trying to keep my breath flowing. I'm trying not to tense up around my shoulders or my legs too much. When you do this, you will probably feel the muscles of your thighs, around your hips, around the back of your hips tensing, right? The extra effort. And when you come back here again, you want to feel like that extra effort is released. And then you can go back down again and come back up again. Now, if this feels okay, stick with this. If you'd like to go further down into more of a squat, come on down further into more of a squat. When I do that, I like to have my knees or my feet just a little bit further apart as I come down into further squat, come on back up again. But you have to decide for yourself today. Does this feel safe? Can I keep my breath flowing? If there's any pain or tension or discomfort, am I going to that place where when I stop, I feel like it calms back down again? Or maybe it's getting hard to keep your breath flowing or hard to keep your body tension low. Then if that's happening, pause. If you want to shift things around, shift things around. If you want to sit and have a break, go ahead and have a break. If you can continue, keep on doing this, and you can make it a little bit harder by lifting your arms up as you do this. So you're still keeping your breath flowing, you're bending your knees and your hips, your arms are coming up. If your shoulders and neck are okay with it to take your arms further up towards the sky, go ahead and do that. Remember, you don't have to keep going just because I'm still going. If it's time to stop, stop. This challenge feels good today. If you're paying attention to all those different things and it feels good, carry on. If you want more challenge when you come down next time, you can lift your arms up and keep them there. Breathe. Check in with the tension around your face, your jaw, and your eyes, your neck. If it starts to build and you feel like you can't keep it from getting too much, that your arms come down, that your necks come back up again. If you are still there, come back to a standing position. Let your arms shift around, move your hips around again. Move your feet if that feels good. Just check in for a moment. Can you come back to that easy breath that you were doing? Can you release the tension in the muscles like you did before? Maybe it's time to have a sit down and just relax for a moment. We're going to change up just a little bit with this. We're going to do one more standing movement just to let you know. So we're going to come from standing. We're going to get you to take your feet a little bit further apart this time. Put your hands on your hips. Smooth out your breath, release tension in your body that you don't need. And you're going to shift your weight over towards your left foot and then bring your right knee up and put it back down. Shift your weight to the other side. Bring the left knee up just to about the height of the hip and put it back down. Now, if you feel like that's too much, you can just lift your heel up and put it down. Right, so you don't need to lift your foot all the way up if your body says that's not the right thing to do today. Or you can lift your knee but not bring it all the way up to that 90-degree place. You get to choose whichever would serve you best today. And if you're not sure, try different things and see which one feels better. Hopefully you've decided how much challenge you want today as you do this. If it's time to stop, stop and pause. Let your shoulders relax a bit. If you need to release your hands, let them release a little bit. You can just shift around your feet a little bit. Hips, go ahead and do that. I'm going to try one variation on this now. Hands back on your hips again. Create that gentle sense of length of your spine. Smooth out your breath. Release body tension you don't need. Your eyes, your tongue, your jaw. Shift your weight over on your left foot. Bring your right foot up, your right knee up, and place your hand on your knee if that's okay. And then take that knee out to the side, and then bring it back to the center and put it back down. If you need to put your hand or want to put your hand on something, go ahead and do that. If you're okay with not having your hand, then do it this way. You choose. You lift your knee up, put your hand towards that thigh or the knee, then take the knee or the thigh out towards the side, bring it back to the center, put it back down. Challenge for your posture. Notice what happens up here as you do this. So the weight shifts over, you're still breathing, you're not tensing up, bringing that knee up, taking the knee to the side, bring it back to the center, you're breathing the whole time, foot comes down, you release extra body tension. If you need to take a break before the other side, go ahead and do that. If you can carry right on, do that. Knee comes up, knee comes out to the side, back to the center, back down. If this still feels good, carry on. You can pause if you want to pause. If you'd like to add one more variation to make it challenging, when your knee comes up and your leg goes out to the side, stay there for a breath or two or three, while you still keep the tension low around your shoulders and neck and face and tongue and eyes. Bring your knee back to the center, put your foot down, and try the other side. Weight over. Bring that knee up if it feels okay. Take the knee out to the side. Pause. Breathe. You're still reaching up. You're still breathing. You're feeling your body not get too tight. Knee comes back. Foot comes down. Give it a bit of a break. Shift around if you want to shift around, or just stand still and come back to that breath. From here, either come back down to laying down on your back, or I'm going to come into a chair again. So just come back either into a seated position or laying down in your back position. And again, it's not time to fully rest. It's time to stay aware and stay alert just for a moment. Let your shoulders relax down a little bit. Move your spine around a bit. Move your shoulders around just a little bit. Maybe circle your wrists around. If you're still feeling any tension there, just move your body around a little bit. Come back to that breath. So whether you're seated or laying down, come back to that sensation of feeling the air swirling at the back of your throat as you breathe in. Feeling the air swirling at the back of your throat as you breathe out. Like your inner ears, your eardrums are sinking in towards each other. The soft palate is gently releasing up towards the crown of your head or your forehead. The base of your tongue is gently releasing down towards your heart. As best as you can for a few breaths, focus all of your attention on the sensation of the air moving at that space at the back of your throat. As you breathe in, as you feel that air swirling, create a sensation of a change in temperature in your body, like you're breathing in warmth or you're breathing in coolness. Make a choice for which one you'd like. Give it a try. And if you do try one, if it feels like the wrong thing, then try the other temperature and see. Each time you breathe in, you're creating that sensation of either warmth coming into your body or coolness coming in your body, whichever would serve you best right now. It could be different from what you did at the beginning. And if it would feel good to add in the color, maybe there's a color that would go along with the temperature change that feels good. So as you breathe in, you're feeling the air swirling and you're feeling that temperature change, and you may be seeing that color. And then expand that out to more of your body. Expand that sensation of temperature change, of color, coming further into your pelvis and your hips and your legs. Coming out into your shoulders and upper arms, elbows. Even coming up into your neck and up into your face and head. And maybe you can feel that temperature change and that color all the way through your whole body. Each time you breathe in, you can create that sensation all the way out to the tips of your fingers and the tips of your toes and the crown of your head, all the way through the back of your body and the front, the right and the left. As you sit for just a couple more minutes, a couple more breaths, take your attention to that part of your body where you get tension or pain or discomfort, and see what happens when you breathe there. When you create that sensation of taking warmth or coolness, taking a sensation of a color to those parts of your bodies as well. If it doesn't feel great to take all of your attention to that place, then bring your attention back to a part of your body where it feels okay to have your attention there. Because sometimes the best thing to do is to draw your attention towards that area of pain or discomfort just a little bit, and then come away to an area that doesn't feel or an area that feels okay. And keep on coming back and forth. But sometimes it feels okay to actually go there and continue to create that sensation there. Whichever one works best for you, stay with it for right now. You can still feel the air swirling at the back of your throat, and you're creating that sensation of temperature change or color through your body. Then as best as you can, let that go. If you need to shift your body around a little bit, go ahead and do that. And just take a moment to check in. Check in with how your breath feels right now. If you can, let go of that breathing in that way. Just let your breath be. And notice what your breath feels like right now. Notice what your body feels right now. Maybe you can feel warmth, or maybe you can feel energy, or maybe you can feel discomfort or tension or pain. Just notice whatever's there right now. Check in with what's happening in your mind right now. Maybe your mind is calmer. Maybe it's not. And check in with what's happening in your heart as well. See what's happening there. If there's anything from this practice today that you want to remember, see if you can park it someplace so that you can remember it and write it down later on. Maybe it's something that you did that you felt, that really didn't serve me very well. And so next time when I approach this, I want to try it in a different way. Or maybe it was something that really did work well today and you want to remember that and want to maybe write about that a bit. So see if you can sort of put that somewhere so you can hold on to it. Because I know when Jen comes back in a moment here, she's going to be asking you to fill out a poll, and we may have some questions that we'll talk about. So just take a moment, sort of grab onto that idea so you can remember it. And then when you're ready, Jen will carry on.
All right. How's everyone feeling? I hope that was great for everyone, and just congratulations for committing to another day of gentle movement at home. We've got a couple minutes. If anyone has any questions for Neil, throw them in the Q&A or in the chat, and I'll read them out. Otherwise, we'll launch the poll. If you can tell us what you thought, that would be really helpful. Oh, here we go. Here's the poll. Super. Last time we had a bit of problems launching it, but here it is today. So that's great. And let me just see, I think we have one question. Well, we have a comment, which is just someone's feeling very relaxed, Neil. So that's that's great. Thank you for that comment, everyone. Yeah. All right, it doesn't look like we have any, I'll give it another minute, but oh, hang on. Wait, we do have a question.
Okay.
All right. This is a really interesting question, Neil. Does the color visualizing help with healing?
That is a really great question. So I guess I would, from my understanding of research, and I read a lot of research, I've never been able to find any that says that you could measure healing in some way, add in a color therapy, and that it would help with the actual measurement of the body tissue getting better. So it really depends somewhat on the definition of the word healing. If the word healing has to do with, does it help us get better? Some people firmly say that that for them, when they do say relaxation and imagine a color, or imagine a color, that they can actually calm down their tension more. Or some people find that certain colors will help them to even just doing strengthening exercises. So there's a felt sense that color is helpful with therapeutic movements and with relaxation. But I've never read any research that says that that you can actually measure changes in tissue healing based on it. But of course, getting better is not just about tissue healing. It's also about getting better on every aspect of our existence. And so far, I haven't seen any specific research on that.
It sounds though that you're saying it's a facilitator to exercises or movements that do encourage healing. It's sort of maybe makes those things a little bit easier.
Yes, and I definitely would throw in the one added bit of that is that it's individual. That some people will say, no, it really doesn't have any, I don't find it has any impact on me. And other people will say, well, yes, it does. And I mean, it's an interesting area, because if you look in marketing and color, marketers will firmly make comments about certain colors drive certain human behaviors. And even the colors of institutions, people use certain colors there because there's a connection between human behavior and color. But it's just in terms of tissue healing, I haven't seen that piece.
Yeah. Thanks, Neil. Okay, we've got another question. This is also a very good question. So someone has written in to say that their knees and wrists really hurt on the floor. So is there another way that they can do these moves? Yeah,
so if I'm guessing that what you mean is that if you're in that 4-point position on your hands and your knees, besides putting more cushions underneath them, and if you're saying that you do it and the pain is provoked and it's not calming down, then we would want to find another way that we could do these movements. So the leg lift from that position, you certainly could do it from laying down on your stomach, maybe not on the floor, that's too hard to get to, and you could do it from laying down on a bed. Moving your spine back and forth like we did from hands and knees, that's again, you can certainly do it from a seated position as well. But I think it would just be finding the right place for you and then modifying it. So the leg lifts from prone, like laying right flat, and the spine movements from this way. You can from prone also lift, one leg and the other arm kind of thing at the same time.